All right, we are now recording and getting started. So welcome everyone to our November Tech and Career Talk. I do say November because we have Thanksgiving 2 weeks from now. So I want you all to enjoy your families and take a break from some of the meetings and calls. So we'll only have one this month and we'll do the same in December. But glad to have you all with us here today. We have a special talk this morning in partnership with Vanguard Consulting Group, led by Akil Bektimba here, who will speak more on that here shortly. But just to give you a quick overview, I'm Devin Jenkins. I'm a staff technical product manager in supply chain analytics with GE Healthcare here in Milwaukee, Wisconsin. I've been involved with BDPA for the last few years. But a little bit about BDPA and the Tech and Career Talks in case you're not familiar. BDPA has been around since 1975. As a way for those in the IT field to have a forum to connect with other professionals and continue to build their skills. But we also have a focus on youth and building their computer programming skills to ensure we keep a diverse talent pipeline in the IT and tech field. So our mantra is advancing careers from the classroom to the boardroom. So glad to have you with us. Our BDPA Tech and Career Talks take place on the second and fourth Friday of each month. We have a variety of speakers. We've had topics from cloud to diversity, equity, and inclusion, to entrepreneurship, to data analytics, cyber. So we cover quite the gamut of topics. And we're excited to have Dr. Cedric Truss and Ms. Marci Bennafield here with us today from Georgia State University, talking through healthcare, informatics, and analytics. So at this time, I'll turn it over to Akil, the CEO of Vanguard Consulting Group, to introduce our guests and our topics for today.
Excellent, excellent. Good morning, everyone. Thank you very much, Devin, and I always appreciate BDPA connection. So today, I'm really excited to kick off this informative discussion about healthcare and the trends in analytics and informatics as it pertains to healthcare. We have some really great guests today, Dr. Truss, Cedric Truss, and Marci Bennafield from Georgia State, as Devin mentioned. And I'm just going to do a quick intro for those of you who don't know these folks. We had Dr. Truss as a program director and clinical assistant professor of informatics at Georgia State. He has more than 15 years of experience in healthcare and public health experience, including 7 years in higher education administration, and his accolades go on and on. I'll give him a chance to kind of tell a little bit more about himself once I finish here. And then we also have Marci Bennafield, who is a clinical instructor in health informatics at Georgia State, with extensive career in healthcare technology and analytics, primarily with IBM, Watson Health, Truven Health Analytics, and MedStat Group. So this should be a very informative and enlightening conversation. We're also going to talk a little bit about diversity, and we won't end this conversation without talking about apprenticeships, which is the program that we work with our partner Net America for the ERAP, which is expanding registered apprenticeship programs through U.S. Department of Labor. So I'm going to be quiet now and hand the mic over to Dr. Truss and Marci, and let them take it away. Thank you, guys.
We have a few slides that we would like to share. But before we get started, I guess I'll tell you a little bit more about myself, and then Marci can talk a little bit more about herself. So I've been in, as Akil mentioned, I've been here at Georgia State for about 7 years now. No, not 7, for 5 years now. And I've been working in academia for about 7, 8 years, going on 8 years now. Come from the industry, did some data analytics, database management, some project management, and some consulting work before I came over to Georgia State. I do have a master's in health informatics from the University of Illinois, Chicago. I got my doctorate in health administration with the concentration in information systems from the Medical University of South Carolina. And I did my dissertation work around ransomware attacks, cybersecurity, that good stuff around happening in hospitals and healthcare. So that was kind of how I focused my work and tied it into what I wanted to do in the long run. Happy to be here and glad to have Marci joining with me on this discussion today.
Hello, can you guys hear me okay? You can hear me?
Yes, we hear you. It sounds slightly muffled, but
It's a
we
little
can hear
muffled.
you.
Okay, let me adjust. And also, can you see the slides?
Yes.
Okay, you are. All right, perfect. All right, let me adjust my speaker a little bit. I don't know if that's any better at all. My name is Marci Bennafield. As you mentioned, I am recently been added to the staff or the faculty here at the university. I was a part-time instructor for several years and before coming on full-time. So I am making the transition from my long career in corporate America into academia. So I'm excited to be here as well. My background, I started in healthcare management. I was early on a biology pre-med major, and a couple of those courses I decided that probably wasn't the right pathway for me, and love healthcare, so switched over to the financial side of healthcare in healthcare management. I have a master's in public health. Started my career with Deloitte. I've worked for Aetna Healthcare, went on to work for MedStat Group, and ultimately our company was acquired by IBM Watson Health. So I have always worked in helping clients use the healthcare data that they have through our business intelligence solutions with a focus on analytics. So I've been applying that to the classroom, and again, happy to be here today.
Thank you, Marci. So now we'll go ahead and get started. So today we're talking about the trends in health informatics and analytics. So first, I'll just kind of talk about what health informatics is. So is any of you familiar with what health informatics is and how it's applied in the industry? You can drop in the chat and say if you are familiar with it, if you're not familiar with it, and I'll kind of give a discussion definition about it, and you'll learn more about it while we go through this talk today. So health informatics is an interdisciplinary study of the design of development, adoption of IT-based innovations in healthcare. So you have the information science, the computer science, and the healthcare part. So the healthcare part, of course, is the part that's focused on the delivery in healthcare. The computer science part is the actual programs that's being used or developed in healthcare. And the information science piece is the actual information that's being captured and how we're using it in healthcare. Also, most individuals would think of health informatics as only the electronic health records. In the EHRs, electronic health records is basically what's used in delivery today. So when you go to the doctor's office, you'll see your physician or your provider entering data into this system, and that's the electronic health record. And so you'll have information that's on that's coming from the physician side. You also have information in that record that's also coming from the administrative side. So it starts from the beginning as soon as you get there into the office at check-in, and it also goes up through into your check-out. Also with health informatics, you have the areas of data analytics, you have areas of information security and privacy, quality improvement, and project management. So all of this works together in the area of health informatics. Again, it's not just the electronic health records that's hit by health informatics, it's everything that's in the healthcare environment today. This kind of got its start back in 2009 with the HITECH Act. And so we've just been pushing forward with it in healthcare since then.
All right, I will just add to that. And oh, I'm sorry, was there a question? All right, well, I will add to that and just share a little bit more specifically about analytics, since that's really my focus area. So when we think about analytics and health informatics, this is just where we can apply analytics to help organizations improve the delivery, effectiveness, and quality of healthcare. So it's the application of analytics to really support the healthcare enterprise. Since I've been working in healthcare for a long time now, but just recently, even in the past 7 years, we've just seen the volume of data increase exponentially. So as Dr. Truss mentioned, the High Tech Act sort of was a huge national initiative to really push the use of analytics, push the use of technology to improve delivery of healthcare and moving things from a paper format to putting more things, having more things being automated through technology. And just as a result of that, we can just see the exponential increase in the amount of data that is now being produced just through the delivery of healthcare. So we're into the exabytes now in terms of the volume of data. And so what to do with all of that data, how to make sense of all of that data, that's really the purpose and the goal of analytics. Analytics is going to leverage the available as well as emerging technologies, and we'll talk a little bit about that. And analytics isn't just about software. Analytics is about the data, which is the cornerstone of our analysis. It's about having the right people and the right skills and training to actually do the analysis. It will include the software, various business intelligence applications, as well as the methodologies and the techniques that we use. And I see there is a question in the, I see a hand raised.
Yes, Marci and Dr. Truss, wanted to check with you on just making sure I'm clear as you're distinguishing the informatics. So when I think about things like the application of things like agricultural development and using technology to increase the agricultural piece as it relates to the health of production of health products, or in the chemical area of using technology to increase, say, pharmaceutical development. Is informatics, I'm trying to see where the line is drawn between what's the informatics part, because as long as it's connected to health, from what I'm hearing you all say, with IT being the distinguishing piece, it makes it informatics analytic candidates. Is that correct? Or where does the line get drawn between when it becomes health informatics as opposed to straight scientific informatics that may relate to ultimately health impacting outcomes?
I'll just say, I'll let Dr. Truss respond as well. When we think about informatics, we think of clinical activity that's happening closer to as a result of the delivery of care. It may very well intersect with research if that research is focused on clinical. But I guess in this context, if you could think about the care delivery setting and environment, that would align more, I think, with clinical informatics. I think the context for more of our discussion. But I'll let you, Dr. Truss, what's your opinion on that?
No, I agree. Also, definitely, as it relates to healthcare delivery and improving the patient care is kind of where we are with this. And it also kind of intersects with public health a little bit as well, because sometimes the healthcare data is shared with the public health agencies. So that's where the connect there is also.
Okay, well, that helps, because I'm trying to say, obviously COVID might be an area of informatics that's because it's directly related to the healthcare there. But if I'm using IT to help people increase their walking ability, that's not necessarily health informatics from what you're saying, because it's not necessarily the care, it's just helping to improve a person's health.
Yes, so if you're collecting data from what you're doing, so if you're helping people walk, if you're collecting data off of that, depending on how you're helping them walk, are you doing this in a therapeutic type of way, or are you using something such as a device to assist them that collects data and tracks data?
Okay, and that would make it informatics then?
Correct. Yeah.
Okay, thank you much, I appreciate it.
Thank you.
All right, thanks for the question. Any other questions? All right, good question. I'll move on just to talk a little bit about the application of analytics in healthcare. And as you guys are probably well aware of, analytics is a hot career in general. Everybody is working to advance their organization's objective using data. And healthcare, though we've been a little slower to catch up from a technology perspective, have been moving exponentially in doing so. So a couple of applications that you may or may not have come in contact with, depending on how much interaction you have with the healthcare system. One is clinical decision support. Clinical decision support is going to be applications that are made available at the point of care to a clinician. So for instance, I could be seeing a patient, have certain characteristics about that patient. When I put that into, my EHR, and a lot of EHR systems are linked to clinical decision support applications, it'll say that I am ready for a particular screening, or it may find something in my history of my data and say that there might be another test that is suggested for me. It could be that I have a clinical condition, but also have another comorbidity with that condition. And it will direct me to resources that will give me as a clinician more information, hopefully to help me as a patient. We use it for just the administration and delivery of healthcare, getting the right services to the right people at the right time. Obviously, analytics is at the forefront of helping us be able to do that efficiently. Privacy, which we're going to talk a little bit more about. Fraud detection. There is an estimated number that I've heard that about 12% of all of the money spent in healthcare is actually is attributed to fraud, waste, and abuse. And so there is a huge initiative to sort of work to eliminate that fraud, waste, and abuse. And obviously analytics is a way that we do that. Mental health research, clinical research around mental health. And this source of this is the NIH. So they have a lot of research activity and analytic activity around mental health. Public health, that's where COVID-19 falls right squarely into that bucket. And we have all been recipients and use of analytics around COVID reporting. Pharmacovigilance, this is where we are using analytic data in order to prevent adverse drug reactions. And this is an ongoing and a very extensive way that we can use analytics as well. I think next we wanted to talk about trends. So Dr. Truss, I'll turn it over to you to talk about overall trends in informatics.
Okay, thank you. So there's a lot of different trends that's happening in the industry in health informatics currently. One of the major trends is cybersecurity. If some of you have been looking in the news, you may have seen some things where some hospitals have come up for ransomware attacks, and they're having to pay these large fees to get access back to their medical records. Also, if you've watched some of the medical shows on TV, I know they've done it on that as well. I know recently The Resident that comes on currently, they experienced something with a ransomware attack, and it took their system offline. And they were able to kind of get it back up before paying the fee, and they were able to expose the hackers as well and get the FBI there. So a lot of that is definitely on the rise in healthcare, especially within the past year when we all, due to COVID, when everything went remote based, all of the telehealth, all of the visits that's done through platforms such as Zoom and WebEx, some of the other platforms as well. It's made it more vulnerable to healthcare to be those victims of those attacks, the hackers, mainly because when the systems were implemented, the correct safeguards were not put in place. Or if they were put in place, they're not still being monitored the way that they should have been. And a lot of organizations are not doing the, backups as often as they should as well. Another thing, the clinical IT advancements, different things that's happening in healthcare. You have the wearable devices now. A lot of people have Fitbits, the Apple Watches, the Samsung Watches, all of these different devices that tracks data. Even your cell phone will even track data that can be tied to your health. I know Samsung has an application, and I think Apple has one as well, where it kind of collects data, like it kind of tell you what your heart rate is, how many steps you should get during the day, or if you haven't moved in a certain amount of time, you might get an alert and say, hey, get up and go for a move or go for a walk. Or just stand up and stretch, because I know sometimes my watch will just say stand up and stretch. Um, those devices, that's something that's becoming more popular. The physicians are able to see what their patients are doing, and kind of being able to provide better care for them as well, especially patients that might have like heart conditions. If they're not as active as they should be, if they're able to see this data, they can recommend changes that would help support getting a better lifestyle. Also, robotics. You have those that's in healthcare, that's going to assist or just assisting with procedures, the different procedures that's happening in the clinics, in the hospitals. The robotic surgery, that's assistive to physicians for certain things. We've come a long way from what we used to do several years ago, and it's happened quite quickly. And I think we're kind of getting the hang of how technology is beneficial in healthcare now. Also, virtual reality. That's happening quite a bit in healthcare as well. For example, you might have a surgeon doing surgery on a patient, and they might be wearing a VR headset. And as they're doing the surgery, it's being displayed maybe into another room, whereas the additional care team is able to see what's happening as it's happening. There also maybe be something for the medical students and the residents to be able to watch while that surgery is happening as well. Of course, with COVID, nothing is the way that it was before. So it's so many different things that's benefiting the healthcare environment through the use of this technology. Also, the advanced EHR modules. We started out with an electronic health record back in 2009, 2010, implementing those. Well, it's 2021 now, so just like your cell phone, the different software, those have to be updated. The software that was initially implemented back 10 years ago, it's definitely been upgraded at this point. So some of the things that we're working towards and wanting to see more of, and this is across healthcare, is the interoperability across systems. So you have the different software EHR vendors. You have Cerner, that's a huge vendor. You have Epic, that's a huge vendor, but the two systems don't talk. So we're doing and seeing a bigger push for interoperability among those systems. Also, standardization. That's something that is definitely needed in these EHR systems, because if you're kind of looking for something, it's where it's documented here, it may not be documented the same the next patient's record. I know back years ago when I was working at Emory and I was looking for some information to take out of the physician notes, one physician would always note their information in the same place, and then another physician would always have it noted somewhere else. So the standardization there would have made my job a little bit easier, especially when it came to like data collection and needing to get data out and report it. So it's important that we see something like this happen as well. And so it's a push, everybody is wanting it, but it's kind of working to get the companies, the software companies, to work together to make it happen. Also, telehealth, again, over the past year and a half, due to the COVID-19 pandemic, telehealth visits have increased. So that's definitely a trend that's happening in health informatics now. Before the pandemic, it was not something that a lot of people really wanted to kind of utilize, but they saw that during the pandemic, patients were actually keeping their appointments. Patients were actually showing up to see their provider because telehealth was available to them. And so this is definitely something that is on the rise and will continue to work for the healthcare organization overall. Also, big data, as Marci mentioned earlier, we implemented these systems over 10 years ago. The amount of data that we've collected from those systems, we're looking at how to use that data now, how to create new systems, how to create new treatment plans. So it's a lot that's happening in healthcare on that front. And now I'll just kind of turn it back over to Marci to discuss the analytical side that's happening.
Hey, Dr. Truss and Marci, we have a question in the chat box from Jeffrey Cunningham. Jeffrey, do you want to ask your question, or would you like me to read it? You can take yourself off mute. I'll go ahead and read it. It says, how has your organization embraced data analytics to drive business decision making?
Well, go ahead.
I was going to say, well, Marci can take it from the organizational side, and then I can take it back from corporate side, and I can take it back from the academia side of how we're using it.
Perfect.
Okay, so what we're doing, I collect a lot of data, and I use it just to kind of see how to schedule courses for the next semester. Also, as far as hiring adjunct instructors, determining what my needs are. And I also report that information to the dean's office, which also goes up to the president's office from there. Also, information such as how well students are performing in the classes, we're reporting that information because it's required basically because SACS has to collect certain data, how we're assessing our programs, how well our students are doing. Are we actually doing what we're saying we're doing? Are we meeting the outcome that we're intending to meet? So it is beneficial. So we are using it quite a bit more here at the university level. We have some new systems in place that they've launched over the past year and a half to track additional data. I keep getting an email that's telling me to log in to enter some information for this new system that they implemented not long ago as well. So we are using it to do a lot here at the university on the academia side to drive those different decisions around.
Okay, and then I'll share on the corporate side. I guess there are two parts of it. Actually, you can think of any corporation that works in healthcare that they may be making healthcare services available to clients. But as an employer, they may also be offering healthcare benefits to their employees. So we can use, so I could take a company like IBM, who has 500,000 employees, offering healthcare services to those employees. Data can be used or information can be used to help target the right services, the right networks at the right time, and hopefully at the right price. But then as we support clients who are using data, this is information to help them decide what service lines do we stay in from a business perspective. How far are our members driving to come to see a provider? So are we in a position now that we should consider opening up a second practice or office location? We use it for fraud and abuse detection. The list is endless, really, in terms of the way that it can be used within healthcare to sort of drive the decisions that we need to make. Quality improvement, obviously at the forefront of what we do in healthcare, has to be measured, and that measurement requires data and analytics in order to do that as well. I didn't know if does that answer your question? Was that Jeffrey?
He's in the back of Uber and he says yes.
Okay, all right, good. All right. All right, I see another hand up.
Hey, Marci. Hey, Dr. Truss. My name is Greg. Thank you all for being here today. And thank you to BDPA and Devin for hosting today. A question I have is, how instrumental is research to the data analytics in health informatics? And in conjunction to that question, how do students get involved in the work that you all do?
Okay, so I'll talk about the student aspect first. So with the work that we do, so we do a lot of different things throughout the program and the different courses. So we have a couple of different health informatics programs. We have an undergraduate program, a graduate certificate program, and a master's level program. So the students, depending on what level, depends on their involvement. Of course, the graduate level students are more interested in what we're doing and they do like to tie that more into the research aspect, whereas undergraduate students, they're a little interested, but they're just thinking, oh, okay, I want to get the degree and I want to go to work. And which happens quite a bit. But what we do, some of the projects or some of the activities we'll do, we do it and set it up to where they can kind of get hands-on experience and tie it to the real world as well. Like for example, Marci does teaches the data analytics courses, and she's able to pull in some of the data from some of the data online that's healthcare related. And she also brings in her corporate experience and tie it in and let the students see how what you're actually learning in the classroom and doing in the classroom is applicable to the real world. And also we bring in different individuals from the industry that's currently doing the job. It might be some leadership, it might be some alums from the program as well. Bring them in and let them talk to the students about how what they're learning, how it is applied, and how it's put to work in practice. Also from the research aspect, the data analytics, research basically revolves around the data that you're collecting. And so data depends on what type of data you're collecting and how it's being collected and how you're analyzing it as well. So as far as clinical research, I don't participate in that a whole lot. I know Marci did mention about the adverse reporting earlier, which she can probably talk a little bit more about the research side of that as well. I know sometimes in those situations, the data that's being collected, it's kind of pushed up maybe to FDA or to another agency and kind of showing what those side effects are or those adverse events, just so it can be documented and kind of placed out as well in the research world.
Yep, I think I'll just add to the, oh, getting a little bit of an echo. Yeah, I would just add to that as it relates to the research, the clinical research, as Dr. Truss stated, our undergraduate program doesn't focus, really on the clinical, research. We start to get into that more in the graduate programs. But in this program, we think more so about the broad range of technology and its application. Most of the data that we're using is already generated. Research will generate new data. A lot of the data we're using has already been generated. We're grabbing that data and now using that data to formulate an analysis. So again, depending on where you are in your educational matriculation and your interests will really drive maybe more how much exposure you may have to research.
Thank you very much.
All right. And then I'll just real quick, I'm looking at our time. So I'm waiting for someone to flag me if I'm going over time. So just let me know in the chat. I'm going to talk real quick about some of the trends in analytics, and then we'll get right on to talking about diversity. So just some of the terminology here and the trends that we're seeing in analytics, predictive modeling. A lot of the work that we've done in analytics has been descriptive or explanatory. This means we're giving understanding and explanation of what's happened in the past. But now what is more important is what's going to happen in the future. What's going to be the trend, so that it could be for asthma, it could be like even for COVID. The reason that the modeling is so important is so that the healthcare organization can respond. I need to have enough nurses available, for the time that I'm going to anticipate this care. I need to have enough hospital beds. So the modeling is important because it helps us understand how to plan resources for future events. We've been starting to hear a lot about artificial intelligence. AI is big everywhere, but the application of AI in healthcare. There are more healthcare journals and articles out there than a human physician can consume. And so artificial intelligence is an attempt to go through all of that information that's out there and helping a provider bring back information that can help them make a clinical decision or a better clinical decision. Dr. Truss talked about interoperability. This is our ability to share all of this data across the healthcare continuum so that my health record isn't regional to where I live. My health record can follow me wherever I am. And so that we eliminate over usage and services. I don't need to have the same lab test I just had, a month ago, perhaps, or, some other diagnostic procedure only because you can't find access or don't have access to the one that I just had. So making this data available so that we can share it across the healthcare continuum is really critical. The term data science, we didn't use the term data science as much in healthcare as we do now. These are a specialized, a skill set specialized in really going into the data and gleaning information from the data, perhaps with no preconceived notion about what they're looking for. What's the data telling me? How can I mine this data in a way to glean new insights? So very heavy computation skills, computer science skills are, we're using these more in healthcare as well. Data mining, using more algorithms to help us understand what's happening in the data, applying algorithms into the data so that we can glean insights. Mining the text. The electronic health record, if you were to look inside that record, only about 60% of that is what we would consider structured or standardized data. The rest of it is free text. These are notes, these are comments that a clinician has put in. And as you may know, a lot of our traditional database management applications prefer structured text. But we are having to now advance our analytic capability to begin to do something with all of this free flow text and all of that data. Imaging data. There's a lot of data that's captured in imaging that has always set separately oftentimes from the standardized data structures that we use. How can we glean information and bring that, incorporate that imaging data into our analytic methodologies as well? So a lot of great things happening from a technology perspective in analytics, and this is more of what we are preparing our students for and getting them ready to play in this, to be a player in this space. All right, and I think our next topic, important topic, is around diversity in this field. So Dr. Truss, if you want to take this slide, I can take the one right afterwards.
Okay, so yeah, let's talk about diversity. Diversity in health informatics. Well, not just health informatics, but healthcare overall. Why is it important? It's important because it can provide a range of experience and backgrounds. It's definitely needed in healthcare because you're going to have patients from different populations. So you want to have a diverse group of workers or professionals to make those patients feel comfortable. Also, diversity, it can lead to increased employee morale and retention. If you have a group of employees, if you see someone that looks more like you, they're more than likely to end up or stay there much longer than they would if they didn't see anyone that's more like them. Also, a stronger feeling of inclusion. I kind of feel included because there's more people here that looks like me. It kind of makes the environment a much better place. Also, again, as I mentioned earlier, better care from the underrepresented populations. Many times, patients that are underrepresented, if they come and see all one type of group of people, they may not feel comfortable coming back or going back to that place because nobody looks like them and nobody can relate to them. Also, if diversity is lacking, what does that look like? It could lead to bias, which can also lead to unfair practices in research and the healthcare delivery. If, for example, I know we all kind of think about the Tuskegee experiment and how this kind of works. So this is one thing that a lot of people think about, which is also kind of why the COVID vaccination rates were down as well, because people would tie that to that as well. Also, limited perspectives. If we don't have a variety, it's very one-sided. A lack of role models. If I don't see anyone that looks like me, I can't expect somebody else to kind of be a role model that doesn't understand what my culture is like. Also, a communication breakdown that can lead to language barriers or the cultural norms. If I don't understand exactly what you're looking for, of what your statement is asking, I don't know how to kind of get that clear.
All right. And so what are we doing to promote diversity? And I am proud to be part of the Georgia State family because those of you, if you're in the Metro Atlanta area, may be familiar with Georgia State and our mission here. And it is absolutely to promote diversity, promoting the ability for all people to get an education, whether it's first generation, an underrepresented group. Regardless, that is squarely inside Georgia State's mission. And though I'm new, this is Dr. Truss's efforts here. Our program is composed of about 95% students from underrepresented populations. So we are absolutely about the business of training up, these populations and getting them ready to get out there and to compete in the healthcare arena. We do a lot of community outreach. We partner with the programs. So we go to where these students are. We partner with the programs to bring them here. Our program typically will pick up with a student after they finish their first 2 years of matriculation at the university, and they'll finish out their final 2 years of their degree in the program. So we target the local programs here that have the 2-year programs of the candidates that we want to bring on. So whether it's Perimeter College or Atlanta Technical, Clayton State, making sure that we're creating the knowledge about this program out there in the community and targeting those students that would be candidates for the program and drawing them in.
I'll add that on this picture here, this is an actual group of our students that were graduating back in 2019. So you kind of see what our student population do look like in the health informatics program. This is not general GSU stock photo. These are our actual students from the health informatics program that graduated in 2019.
Absolutely. So I'll go just real quick, and won't read all of this. I know we're short on time, but what is health informatics? What does that look like from a career perspective? Here are just a few of the job titles that you might see. The titles sometimes they can apply in general careers, but think about them being applied within a healthcare organization. So at Grady or at a Piedmont. This is again just a sample of some of the careers that our students really move into after they finish the program. A lot focused on IT, on analytics, oftentimes with the systems development, systems design. Again, very close to technology, as many of you are. But very focused within healthcare and understanding the application of healthcare, of the technology within healthcare. So oftentimes that makes it important that you know the terminology, you can interface and have a conversation with a group of nurses about how an application will be applied. So again, that's the piece that we are equipping our students with.
And I know also with the careers, the health informatics careers, I know Akil has mentioned apprenticeships programs in the past as well. And so this is something that we've done some research and we haven't found a whole lot of programs that's health informatics related. So as far as apprenticeships, we did find something that the CDC has started or they have in place, which is Public Health Informatics Fellowship Program, which is similar to an apprenticeship. And so maybe this is something where health informatics organizations, or maybe something where we can kind of work and see that this is where apprenticeships can kind of take place.
Absolutely. I thank you for that. And first of all, you guys are doing an amazing job over there. I think that picture shows how important the work you guys are doing. I just want to kind of reiterate some of the things that you guys are saying about diversity in tech in general, right? Obviously, diversity in healthcare informatics is incredibly important. You mentioned, Dr. Truss, the distrust from the communities as it pertained to what we experienced with COVID and lack of folks interested in vaccinations or even being tested in a lot of places because of those kind of historical happenings. And so I think that that's a really important thing. And the more of us involved, the more representation we have, the better it is. And just tech across the board, which the folks here on this call know well, and I know BDPA talks about diversity in tech in general is important because we're still between 5% and 10% representation in that, in that kind of career sector or industry sector. So that's excellent. I'm also very glad and appreciative that you guys talked about apprenticeship a little bit. And we know that, as much as, Georgia State and other universities are doing as it pertains to degree programs and getting more students involved in those degree programs. We also know that apprenticeships and experiential training are another route. And a lot of that can be in partnership and is in partnership with universities. So looking forward to working with you two further around possibly developing additional apprenticeship programs to expand the opportunities for those in that area. So just wanted to mention that. Thank you guys so much for mentioning those 2 points. I don't want to cut you off. Keep going. We have a couple more minutes. And I don't know if there's any other questions. There was one about copy of the presentation. I'll let Devin respond to that, and then the recording, he can respond to that also. But you guys have a couple more minutes here.
Yeah, and we did have from Jeffrey in the chat. He asked, how would a potential student connect with Georgia State to learn or enroll in your programs? He has a nephew who's a viable candidate, so you might want to connect with him. And then he also asks, which industry has been the leader in utilizing data analytics outside of the big companies like Facebook, Google, Apple, et cetera?
All right, I'm sure Dr. Truss is probably dropping the link for the program in the chat. So get your nephew in. And then the big companies that are using healthcare analytics, I guess is what probably where I could speak to. And it is the clinical setting. They are using analytics more than they ever have in order to make decisions. We're not just relying on our gut feeling about things. We're not just relying on, what we've heard. We're letting the data help us make the right decision about our next steps. So we're seeing it on the clinical side. And these are areas outside of traditional IT per se that are really starting to use data, using analytics to help drive decisions. This was just
also
companies. This was just talking about why Georgia, why this area when it relates to health IT, and this is just a snippet of some of the companies, as you all well know, those that are here locally. There's a lot happening in Georgia in health IT.
Yeah, it's definitely a lot of health IT companies, startups from the ground up here in Georgia, quite a few in the Atlanta area. So there is a lot that has happened. We've come to work with a few startup companies. With our program, we have students that go and intern with those startup companies, and they leave those startup companies and go get successful jobs for some of the larger companies as well. So it's definitely a lot that's happening here in Georgia.
And I think the last slide we had was just really, if you're interested in health informatics or knowing more about this space and what we're doing, these are some of the professional organizations that we rely on and we partner with as well. So I think we are going to make these available, but again, these are some of the organizations that Dr. Truss and I are members of and help us stay connected and current with what's happening in informatics.
And actually also add, so the HIMSS organization, we do, that's a membership-based organization. And so we provide memberships for all of the students in the programs, and it's free to them. Normally they would have to pay out of pocket, I think it's $30 or $50 for the students per year if they wanted to pay for it out of pocket. But I kind of made it available to students that's enrolled in the health informatics program, and that's from the undergraduate program up to the graduate level program. Also, the past couple of years, we've gone and attended the national conferences that HIMSS hosts. And a lot of the students, they go, they network, they kind of volunteer at the conference, and a lot of them kind of end up networking there and building those connections and get jobs with some of those organizations that they've met there at that conference. So it's definitely a lot of resources available. We connect students with things that we have access to, and we just kind of put them out there and let them get the experience that they need.
That's fantastic. I think as we close, I don't know if you guys have any final thoughts or final words you want to mention before we close up, but this has been an incredible conversation, and I am incredibly enlightened myself and excited about the future of on the apprenticeship side of developing some opportunities that way and linking with you guys on in that way in those areas. So I give you guys a couple more minutes to kind of close out, and then Devin and I can close this session.
All right, I think all I would just add is that, just think about healthcare as you are in the technology space. Healthcare is a multi-trillion-dollar business in the United States. So there's a lot of overlap and applicability from a technical perspective in healthcare.
And I'll add to that also, I know sometimes students get intimidated by it because they aren't sure what health informatics is. They feel like it might be something where they have to be programmers, and you don't have to be programmers in this field in health informatics. I've worked in data analytics. I know most classes offer data analysis and database management in their health informatics programs now. Back when I did my master's, it was not a data analytics or a database management course, but I got a job as a data analyst, and we used SQL. So I taught myself SQL a little bit. I'm definitely not an expert at all. I'm pretty sure the students now get more training on it than I know how to do, but I was able to kind of figure things out and get a lot done. And I know Marci mentioned also the business intelligence software that's available. So having those available, you don't have to be that strong programmer because those software packages do a lot of the work for you. So definitely just kind of be open-minded and be able to kind of be innovative in healthcare. And I think this is definitely something that anyone would enjoy doing.
Fantastic. Thank you both so much. In the chat box, you'll see some information. You'll see the healthcare informatics at gsu.edu from Dr. Truss. I think his email is in there as well. I've also added that we are working on, like I said, informatics apprenticeship opportunities through Vanguard Consulting Group and the partnership with BDPA and other partners. I put my email address and also my colleagues' email address there. And before I finish, I would definitely encourage you all. Next week is National Apprenticeship Week. Through the Department of Labor has identified next week as National Apprenticeship Week. And our partners at Net America is hosting a AppCon 2.0 event. It'll go from Monday through Thursday, and it'll be similar to this as far as content, but it'll be some interactive virtual booths and vendor booths and other engagement and other conversations. And I really encourage everyone to check that out if you have some time next week. I also put in, if you see in my last entry into the chat, the workforceimpactnetwork.com. Go to that website and you will be able to register for next week's activity and find out more about what we're doing. So thank you for your time, and thank you, Devin, for hosting us.
Thank you for joining us, and thank you, Dr. Truss and Bennafield, for sharing with us today. I've dropped their LinkedIn links in the chat as well, so please connect, reach out. I'm gonna keep these conversations going. And I've also shared our Tech and Career Talk website if you want to watch some of our former talks. And this is also where the recording of this session will be stored here soon. So thank you. Have a great weekend. Enjoy your Thanksgiving holidays. We'll be back in December.
Thank you.
Having us. Thank you.